Good morning.
Morning.
Good morning, everybody. Welcome to the Hindus Wellness Series webinar presented by Kauvery Hospital. Today's webinar is on a subject that's increasingly being talked about lately, the rising incidence of strokes among young adults. Let me begin by introducing you to our esteemed panelists. Our first panelist, Dr. Sivarajan Thandeswaran, is a senior consultant, stroke and neurovascular medicine at Kauvery Hospital in Chennai. He specializes in stroke medicine, neurorehabilitation, neurointensive care, general internal medicine, and gerontology. His areas of interest include spasticity management, headaches, Parkinson's disease, and dementia as well. Dr. Sivarajan has had publications in a number of international journals, including Brain and the American Journal of Neuroradiology. He has also had poster presentations at various European stroke conferences. Welcome, Dr. Sivarajan.
Thank you. Thank you so much for a kind introduction. And it's a nice morning out there. And
Our next panelist is Dr. G. Joss Jasper, Head of Brain and Spine Surgery at Kauvery Hospital in Trichy. Dr. Joss completed his MBBS from CMC Vellore and then his MCH from Stanley Medical College in Chennai. Dr. Joss has almost 2 decades of specialty experience. He started the neurotrauma ICU at Kauvery Medical Center in Vellore and also helped establish the first exclusive stroke care center as per European Stroke Association's criteria in 2008 at KMC. He was also instrumental in pioneering the use of a number of advanced techniques for brain and spine surgery in Trichy. Welcome, Dr. Joss. Our final panelist is Dr. S. Sendil Babu, a senior consultant in neurosurgery at Kauvery Hospital, Tirunelveli. Dr. Sendil Babu specializes in endoscopy, microscopic neurosurgery, vascular neurosurgery, and spine surgery. His field of interest includes tumors of the brain and spine. A very warm welcome to all of our panelists. We will now begin with a presentation from Dr. Sivarajan.
so thank you so much. And I'll start screen sharing.
There's a that corner, in the corner there. Hidden zone.
So World Stroke Day is usually observed on the 29th of October every year. Since the year 2006, it was initiated by the World Stroke Organization to create awareness of stroke and how we can prevent it, and also the treatment modalities that has been evolving over the years. And the main sort of theme of World Stroke Day is to see how we can educate the public so they can win over stroke. And this year's theme is to be greater than stroke through the medium of sport and well-being and so on. So in this on this World Stroke Occasion Day, we have three of our Kauvery doctors, myself, Dr. Jose Jasper, and Dr. Sendil from Tirunelveli, Dr. Jose Jasper from Trichy. And I would like to start by congratulating Dr. Jose Jasper for being awarded the Diamond Award on stroke sort of service delivery in his hospital, and out of many hospitals across the world, Trichy Kauvery has been awarded Diamond Award. It was given 2 days ago at the World Stroke Organization conference conducted at Abu Dhabi. And well done, sir.
Thank you, Dr. Sivaraj.
So, to start the talk, I'll first start by briefly telling a bit about the functional areas of the brain, because when we say stroke, most often everybody think it as a one particular entity, but unfortunately, it's not the case. So, our brain is very versatile and it has got varied functions, and each and every function is located in specific areas in the brain. For example, if we say at the front of the brain, the frontal lobe deals with higher intellect, self-control, inhibition, emotions. And as we go a little bit further behind, we have motor cortex, sensory cortex, and areas for speech production and speech delivery, areas for language, comprehension, vision, and so on. So when somebody has a stroke, we always assume that my relative or friend had a stroke and this person also had a stroke, but somebody had recovered well and somebody has not recovered. That is simply because of the way stroke happens. No two stroke patients are the same at any given time point. Unlike other conditions, stroke is a very heterogeneous problem. And as you can see in this little picture of how the motor and sensory cortex are uh, programmed to do certain actions. So you can see starting from on the right side of the slide, there are specific areas for the tongue, gums, lip, speech, hand, fingers. You can see the thumb has got a very large representation that kind of simply says how we evolved from the apes to humans, if we believe in that theory. And as you can see, we have a large representation for the face and the lips, and also for sensory tactile areas that concern to fingers. So that's one of the reasons when we have a stroke, we often have facial asymmetry, hand involvement, and also speech involvement. That's the part of a fast stroke sort of easy pickup tool, FAST. Most of us are aware of it, like face, arm, speech, and test. That's simply because if somebody had a stroke, quite often these areas are affected. So when we dive into strokes are of many types, but 80% strokes are due to thromboembolic phenomena, and some of them can be due to global ischemia, post cardiac arrest, or sudden drop in blood pressure when they have pre-existing carotid artery disease. And some of the strokes can be hemorrhagic in nature, roughly about 20% of the strokes. And within hemorrhage, there are many types, and Dr. Jose and is going to elaborate on the various treatment modalities we have for ischemic as well as for hemorrhagic strokes. It can be epidural hematoma, subdural hematoma, typically seen after falls. Sometimes it can be subarachnoid bleed, which is normally seen in seen in aneurysmal bleeds. Aneurysms are very rare, fortunately, and sometimes it can be in the brain itself, which are typically seen in those who have very high blood pressure and diabetes, which are out of control. Very rarely, the bleed can be in the ventricles, with the fluid spaces in the brain, which can cause secondary trouble like hydrocephalus and so on. So in this webinar, we are going to focus a little bit on young strokes because we are seeing a lot of youngsters coming with strokes in the age group of less than 50. And the problem is when youngsters come with stroke, almost the whole family is affected because they are the breadwinners of the family, and everybody in the family have to chip in to spare their time and effort to help in their recovery. They may have very young children whose education and further career path and life can be affected. And almost a quarter of youngsters who commit strokes are due to bleeds, which carry a very high mortality, unfortunately. And with the advent of better ambulance services in our state and also better scanning facilities, we are seeing picking up at least a more number of subarachnoid hemorrhages which were previously missed. And the incidence is rapidly increasing as we speak. So if you look at the outcome of youngsters having a stroke, the slide shows on the left ischemic strokes and on the right to deal with hemorrhagic strokes. And the color bars tell about the fatality or mortality at 1 month, 1 year, 5 year, and 10-year time points. If you look at ischemic strokes, nearly 5% of individuals are going to die. And if you look at hemorrhagic strokes, nearly almost 20% chance of dying if somebody had a bleed stroke. And as time move on, the number of people who die with ischemic strokes increase in number. That's probably because most of the individuals who um, survived catch up with other risk factors, other complications of stroke. But if you look at the hemorrhagic side, majority of the individuals die in the early stages, and slowly a lot of others may also lose their life because of complications. So it's very important to have well set up services to preempt this complication at the early stages of hemorrhagic stroke. And women have a slightly higher risk of stroke than men, and it's mostly because of the lot of hormonal changes and the other lifestyle conditions they face with. So when if you compare a normal individual to a pregnant woman, they are more likely to have a stroke, and that's mainly because during pregnancy there are more hormonal variations, and they are three times more likely to have a stroke. And women who have hypertension or gestational diabetes, they carry a very high risk of stroke, and it's almost double the normal population. Women who have headaches, especially migraine with aura, they have a slightly increased risk of stroke, and especially if they also smoke, the stroke risk is doubled. We do see a lot of women who take birth control pills, and also women who are given hormonal treatment at the menopausal stage to control dysfunctional bleed or also symptoms of perimenopause. And even those time medications can also increase clotting risk if they have additional other genetic risk factors. Women are also prone to have atrial fibrillation, which is irregular heart rhythm, and especially if they are very stressed, if they have other comorbids. And when, as a society, women look after the whole family and men, but we hardly think about the other way. We don't look at uh, health issues in women because it's so busy with day-to-day work and running the family and so on. And we always encourage women to do health checkups to make sure they have any hidden hypertension, dyslipidemia, or if they have any evolving heart conditions. So it is something we advocated our hospital to make sure women are encouraged to do master health checks and regular health checks. So we have traditional risk factors for diabetes, especially risk factors like diabetes, hypertension, dyslipidemia. Diabetes is very unique because it increases the prevalence of both hemorrhagic and ischemic stroke, and women especially have 2 to 3 fold risk of stroke if they have diabetes. And luckily, we have quite a lot of medications that can offset the problems. And there are a lot of newer diabetic medications which can reduce a stroke, like the glitazones and recently the semaglutide, dulaglutides, and metformin, SGLT2, and DPP4 inhibitors are pretty neutral. And sulfonylureas may increase stroke risk. And this sort of information is very important because those who have diabetes have a higher risk of atrial fibrillation, and when they get hospitalized with stroke, the complications are much higher if somebody has diabetes, and the stroke volume or the ischemic area and the penumbra, which is the area that is surrounding the initial core, may not be easily salvageable if somebody had very high sugars in the immediate period post stroke. So hypertension is a very common risk factor, and it can affect any part of our body. It can affect the eyes, leading to loss of vision. It can cause hemorrhagic strokes or bleeding in the brain. It can also cause silent strokes, meaning individuals can develop dementia, gait problems, and bladder issues. It can cause stiffening of the arteries and enlargement of heart. It can cause trouble to the kidneys and cause chronic kidney disease and end up someone in a dialysis at a very early stage. Aneurysms, meaning enlargement of blood vessels, can cause either in the chest, thoracic aorta, or abdominal aorta. And it can also cause blocked arteries in the peripheries, causing peripheral vascular disease. And high blood pressure is one of the commonest risk factor for stroke and easily treatable. Almost in general, 80% of strokes can be easily prevented, and majority of that can be achieved by having a proper blood pressure monitoring. More than 1 in 3 adults who have high blood pressure don't know they have it, and even if they know, half of them do not control it adequately. They assume taking one prescription is enough, and they may not monitor it, and by the time they come back for next review, the blood pressure is haywire. And same way, so there are some individuals who have variable blood pressure. So for example, at one visit they may have a regular blood pressure, and when they go home, especially at night time. They may have high blood pressure in the evenings and high blood pressure in the early mornings. We call them as non-dippers. Normally, when we go to sleep, our blood pressure drops, but there are individuals who have high blood pressure during sleep and early mornings, and these are the individuals who are prone for hypertensive bleeds in the brain. And quite often, we get these individuals early in the morning. They have a sudden change in their normal function. They are unable to wake up from sleep. Nearly 10 to 15% of strokes are due to are picked up at the early morning when they are woken up from bed by their partners. And the risk factors for blood pressure is very quite in front of our eyes. And as I said earlier, women have slightly high risk of hypertension, lack of physical activities, obesity, increasing age, and stress and anxiety has become a major problem nowadays, causing high incidence of hypertension. High salt diet is very prevalent. I mean, in a fast moving world, everybody's more into fast food, especially biryani, um, because it's easy and it helps them with carrying on with their work and so on. So we do see very early incidence of hypertension in youngsters, which translates to high incidence of heart attacks and strokes in youngsters. Alcohol in moderation is okay, but we do see a culture of binge drinking in youngsters, unfortunately. Smoking and even drugs have become very prevalent, which can increase the incidence of strokes. Caffeine in moderation is okay, but caffeine in excess is always dangerous. Cholesterol, as we all know, we have high density cholesterol, low density cholesterol. High density cholesterol is a good cholesterol. And what we advise our patients on in general public is to know the numbers. What number is ideal? If you have a high LDL, then the risk of blocked arteries is higher. So we want it to be less than 100 in any given individual. But if somebody had a heart attack or stroke, we want it to be less than 70, especially the LDL. And HDL is better if you have a higher number. If you have more than 60, it's optimal, but it's very often very hard to increase your HDL unless you have a very good lifestyle, if you do the right exercises and so on. The other common risk factor that is easily overlooked is sleep apnea, which is increasing by the day, and as increased risk of obesity and sedentary lifestyle continues in our society, we do see a lot of individuals who have sleep apnea. This chronic condition causes frequent episodes of upper airway collapse during sleep. So there are individuals who have very thick tissue in the neck or increased fat tissue in the neck, which can happen during sleep. As we sleep, our body muscle tone drops, and often, if you look at your, if you lift somebody's limbs, it will be very flabby and floppy. So same way, the airway muscles can become very flabby, and it will block the air going in and going out. That's why you get the snoring noise. Often 80% of those with this problem are undiagnosed, and the easy way to catch these are asking individuals if they tend to fall asleep during day hours, especially while driving or when they are bored and sitting and doing nothing. And almost half of people who have OSA also have hypertension. And when you have OSA and hypertension, then the risk of stroke and heart attack increases. And people with OSA are 2.4 times more likely to experience a motor vehicle crash, even. And people with OSA also have a high incidence of diabetes and strokes. So it's very important to ask your family member if they are a snorer, and if they have snoring, if they have apneic spells like breath holding spells, and if they have breath holding spells, to consult your to see if you need a sleep study which looks at your sleep apnea score, which may say if you're moderate or severe category, if you have severe or moderate category of sleep apnea. If you have sleep apnea, then it's very important to get the right treatment, get your lifestyle changed, and reduce your risk of stroke and heart attacks. And I would like to touch a little bit on stress and anxiety. So, stress is something that we have it every day. Stress is we call, we have two different spectrum of it. When you have short episodes of issues of anxiety, anger, which may be prompted by certain circumstances, it's called stress. But if you happen to have stress on a regular basis, then you get into the other side of the spectrum where you have anxiety disorder. Okay. So when you have frequent episodes of stress, you may get into anxiety and depression. So when somebody has stress and anxiety, you have a multitude of bodily symptoms like digestive symptoms, gastritis, easy fatigability, lack of sleep, irritability, which leads to elevated blood pressure, which leads to increased heart rate. Some patients come in with severe headaches, and intense worry can cause increased bowel activities and so on. In extreme situations, patients may have panic attacks. And we have quite often encountered patients who come in with a certain stressful event in the family or friends, and suddenly they have extremely high blood pressure. When we do the lipids and sugars, everything is extremely high. And after having adequate treatment for the stress and anxiety, when we recheck their blood pressure, their numbers with lipids and sugars, everything has fallen down to near normal levels. And that's purely mediated by these mechanisms in our body called sympathetic adrenal medullary system and hypothalamic pituitary adrenal axis. So when you are under a lot of stress, the amygdala, the part of our brain, and gets stimulated, which induces the hypothalamus to release hormones, which in turn stimulate the adrenal gland, where epinephrine or adrenaline is released, which can get into the bloodstream. And it's basically designed in nature to help us face emergencies. But if it happens more frequently, then it can cause the stimulation of the pituitary adrenal axis, where instead of the adrenal medulla, it stimulates the adrenal cortex, where it releases a lot of cortisol. Cortisol at frequently high levels can cause uh, more harm to the body, leading to changes in our arteries, increased endothelial injury. It causes reduced vasomotor reactivity, meaning the elasticity of the blood vessels are reduced. It can promote increased wall thickness, and it can cause impaired autoregulation and impaired metabolic state, meaning you may be pushed into pre-diabetic state or atherosclerotic state. So being stressed consistently is not a good thing. Some amount of stress is good. Without stress, we can't function. Uh, so if you look at this nice graph, if somebody is not at all stressed about anything, then you would notice that they have very impaired performance. They are bored all the time. They are like lazy and inactive. If you have the, I mean, we, if you have extreme stress, then you will have exhaustion, fatigue, anxiety, panic attacks, and you may burn out and quickly break down. So this is very important for individuals who are in a very stressful work. I see bankers, IT professionals who have extreme amount of stress due to targets and deadlines and so on. So it's very important to consult the right professional to have the right amount of advice, lifestyle changes to keep stress under control. So this is a graph that depicts what happens when you have stress. So if you look at global stress, the and if you have never had a stress, which is in the top left corner of the graph, in the middle shows some amount of stress, and the right of each graph shows severe periods of permanent stress. Then you can see the incidence of stroke and bleeding strokes are very high if somebody has a high amount of stress consistently. And it same is true with, so A is for global stress, B is for work stress, and C is stress at home, D is financial stress, and E is stressful life events. At any given time point, whether it can be home stress, financial stress, work stress, the incidence of stroke is high if you have a consistently high periods of stress. So it's, if you feel like you have stress, don't shy away. A lot of people see it as a taboo, and they don't come up front with their feelings of stress, because they may feel like it is some sort of a taboo. So it's better to consult the specialist and take some advice on lifestyle modification, and even seek a psychiatrist advice. So quite often people shy away from going to a psychiatrist because they see that as a taboo. So please don't feel that way. If you have stress, we need help. Stress is something everybody in this world have, so we have to get it sorted. And apart from stress, the environment that we live in is also contributing to increased risk of diabetes, hypertension. So, increased urbanization, pollution, excess light exposure, and obesogenic food in the lot of poor dietary choices. Individuals with high BMI have altered gut microbiota, and they have worse glucose metabolism and lower brown adipose tissue. All of this in turn increases our risk of okay. So, what do we do when somebody has a stroke? So, this is where I would hand over to Dr. Jose Jasper. We have certain treatment options in the immediate period after stroke. So, stroke is a time critical emergency. So, when somebody has a stroke, up to 4.5 hours, we have a thrombolytic treatment. And even at that time point, if somebody has a large artery clot, quite often the clots are very hard to be busted by the clot buster. So we do have a mechanical thrombectomy as an option, which is available across all our hospitals. Mechanical thrombectomy is the latest advance in our stroke management, which can be delivered up to 8 hours to even 12 hours after onset of stroke. In certain cases, we can even go up to 24 hours, especially if the stroke is involving the basilar artery. Um, the treatment options have their own time limits, mainly because when we open up the artery, it can cause slightly increased risk of hemorrhage. So the patient selection is very important. That's why we always say you have to be in a setup where all this can be easily checked and managed. So I would pass on to Dr. Jose Jasper, as he's going to dwell more into treatment options. Thank you.
Thank you so much for your detailed presentation, Dr. Sivaranjan. Dr. Jose Jasper, can we move on to your presentation now?
Really. 1 second, I'll just do it. Yes, am I visible?
Yes, sir, you're visible.
Okay. Thank you, Dr. Swarajan. Sir gave a very, detailed talk about what are the reasons or why we have so much of stroke now. In fact, what I would like to start my topic with is post-COVID, we have seen a huge surge of unhealthy lifestyles, sedentary lifestyle, watching OTT programs and eating outside, especially all this midnight biryani and all that. It is really contributing to a huge stress on India's health system, especially on the youngsters who are mainly between 25, 30, 40 years old. With that, I'll straight away jump into my talk. It is actually surgical management of stroke. And I'm going to talk only about where we operate in cases of blocks or ischemic strokes. So, do all patients need surgery? if you have a block, if you have a stroke, only less than 15 to 20% of them will actually need surgery, because most of the other patients, almost 80%, will be managed by specialist neurologists like Dr. Sivarajan. So there is no role for a surgeon in that part of the disease at all. So when do we operate? We operate when a very large vessel is blocked. Small vessel, you'll get minimal deficits. You can get away with it. Large vessel, usually you have to try to revascularize the brain again. Very young patient, where the odds of the patient making it through is very tough. Then again, surgery has a huge role. And the patient is clinically worsening in spite of best medical management, then also we'll have to think of surgery. And sometimes we give these drugs to break down the clots, drugs known as RTPA and alteplase, and rarely they can cause bleed inside the brain. So even then, a patient with a ischemic stroke can actually need surgery. So there are, surgeries uh, are of two types actually. That is how I'd like to classify. One is therapeutic, or this surgery treats the disease or treats part of the disease or a complication of the disease. So therapeutic surgery is done both for ischemic stroke or blocked blood vessels as well as for ruptured blood vessels. But that is a topic Dr. Sendil will be talking about. And prophylactic or preventive stroke can also be a preventive surgery for stroke is also there in the this thing agenda now. So what do we do? Before going to the treatment part, the therapeutic part, I thought I'll highlight the preventive surgeries that are available for blocks. And to start into that topic, I have to really answer this also. Health checkups, are they of any use? Because in India, somehow health checkups carry a very bad, image where people think like hospitals are out to please them, which is why they encourage health checkups. Unfortunately, the situation in India, when compared to the Western population, is different. Western population undergo routine health checkups as part of their academic programs, as part of their professional lifestyle, professional work programs, etc. But here in India, it is not done routinely, which is why health checkups play a very huge role in preventive, care. So the basic things that health checkups tell us, they help us to know our body. It is not enough just to see what is outside. You have to really know what is inside. They tell us about our height, our weight, our body mass. So body mass tells us whether we are, healthily weight is healthy or we are obese, etc. It tells us about our hypertension. It tells us about our sugars. It tells us about our cholesterol and heart status. All these are things, numbers, which already Dr. Sivarajan said. And what we have to remember is we have to know our numbers. I think that message is very important. You might look healthy outside. Just the other day, 1 or 2 weeks ago, I had a patient, 30-year-old, very healthy lifestyle in the sense, lots of running. He walks into my OP, I can see he's been going to the gym regularly. Then I look at the blood results, all is, lipids, cholesterol, etc., are way off the roof. So you have to do these things to know your numbers. And as part of health checkup, in high-risk patients, suppose there's a family history of stroke, or if this patient has history of warning strokes, then we suggest a test known as a carotid Doppler. We know that the heart pumps blood to the brain, and it has to cross the neck to go to the brain. So what we do is we do an ultrasound study to check the flow of blood to the brain. And as it crosses the neck, we can use an ultrasound and see how is the flow. So here you have two pictures. The pictures are self-explanatory, normal blood flow and abnormal blood flow. So when the blood vessel starts shrinking, like because of deposition of fat and plaques and all that, then the blood flow starts getting affected. This is nothing hi-fi. This is what happens even in our homes when you have salt water. All your taps start getting like lines settling and something like that. So you need to descale. So something like that happens here. So what happens if there is a block? Then obviously you have to decide with the neurologist and the neurosurgeon who have expertise in this. Most of the blocks will need only medical management. Up to 60-70% of blocks can be managed with best medical practices done under supervision of a clinical neurologist, a stroke specialist. And some will benefit with open surgery. wherein we go in actually and we open the carotid artery in the neck and you remove the block. So this is usually done for younger patients. And rarely you can also place a stent across the block. So something known as a carotid artery stenting. So these are preventive procedures in the sense they prevent strokes. So this is a life-saving and function-saving surgery. And very, very rarely what happens is the blood flow in the neck is good, but the blood flow inside the brain can be blocked. And this also manifests with recurrent, ischemic attacks or recurrent episodes of weaknesses, especially in younger patients. So there, again, all these are done when strict criteria, clinical criteria, radiological criteria, etc. What we do is we take a blood vessel from outside the brain and connect it to a blood vessel in the brain and establish a bypass. So not only hearts, but even brain can undergo bypass. So this bypass will get blood from outside into the brain and increase the flow, augment the flow. And apart from this, echo also, cardiac study also plays a very important role, especially in selected cases, we ask for what is known as a transesophageal echo or a bubble echo. And this will pick up rare cardiac causes of recurrent stroke, which may need surgical management or cardiac intervention also. So now going to my topic of ischemic stroke. The most important surgery we do is always decompression. So the head is a closed box. It's a closed box. And you have blood inside, brain inside, and fluid around it, CSF inside. Now, all these have a equilibrium. If the volume of one changes, then the pressure will increase because this is a closed box. So when there is blood flow to the brain is stopped due to some reason, the brain cells start dying. And when they die, they necrose. And when they necrose, they start releasing inflammatory markers and they become edematous or swollen. When you hit your head or bang your head against the wall, you get swelling. So something like that happens inside the brain. But when there is swelling inside the brain, there is no place for the brain to escape. And so the brain starts getting compressed. So this surgery does nothing but release the pressure inside the brain. So this is a normal brain. You can see everything is symmetrical, bilateral symmetrical. There is the strict midline. And here you can see a big arrow that I put. You can see a nice smile. That tells me that black spaces are spaces where you have CSF or fluid. So the brain is in its space, CSF is in its space. But when you start getting ischemic infarcts, brain starts swelling, you can see the midline shift and even the smile starts going off. So here, if we wait, what happens once the pressure goes beyond a particular level, then blood flow to the opposite brain also is lost and we start losing the patient. So in this case, what we do is we actually do a decompressive surgery. So we remove the bone. We open the covering of the brain, go in, and in spite of that, if the pressure is not relieved, we sometimes remove part of the damaged brain also, and maybe even remove a bit of CSF. We are trying to give as much of space for the brain to expand. And if the brain is still tense, we do not replace the bone flap. We take it away. Once the patient improves after 4 to 6 weeks, we plan for elective surgery and we replace the bone, either the bone itself or using a titanium mesh. So what you have to remember is time is brain. And any decision making, either preventive or therapeutic, must be done at the right time to salvage brain. What will help in saving the brain is this. One is awareness of stroke. Second is lifestyle modification with specific awareness of R numbers. And third is early assessment and management in a comprehensive stroke care center. So with that, like Dr. Swarajan said, we are very happy to say that for a small tier 2 city, we have won the Diamond Award for Comprehensive Stroke Care Center. It's difficult to bring, Stroke Care Center is not only about people, it is about lots of technology, lots of investment, lots of awareness programs. And we are proud to say we have received this Diamond Award as, to highlight our work done in this specific category. With that, I'd like to say thank you and hand over to Dr.
Thank you very much, Dr. Jose. That was a very comprehensive presentation, and congratulations again on winning the award. Let's move on now to Dr. Sambal Babu's presentation. Doctor, you're on mute, doctor.
Can you hear me now?
Yes, we can hear you now.
Thanks, Sivarajan sir and Jasper sir. Can you hear me?
Yes, doctor, you're audible now.
They have already explained everything. I'm here just to talk about the surgical management of the hemorrhagic stroke. I'm Dr. Sendil Babu, a neurosurgeon from Kauvery, Tirunelveli. நான் வந்து சார் சிவராஜன் சார் ஏற்கனவே சொன்ன மாதிரி மூளையில் ஏற்படும் இரத்த கசிவுக்கு வந்து இரத்த கொதிப்பு தான் ரொம்ப முக்கிய காரணம். ஸோ இரத்த கொதிப்பினால் ஏற்படும் இரத்த கசிவை பத்தி நான் முதல்ல சொல்றேன். ஸோ அதுல எந்தெந்த பேஷண்ட்டுக்கு நம்ம அறுவை சிகிச்சை தேவைப்படும், யாருக்கு தேவைப்படாது, யாருக்கு பண்ணாலும் பிரயோஜனம் கிடையாது என்பதை பற்றி நான் கூறுகின்றேன். ஸோ ஸோ எந்த பேஷண்ட்டுக்கெல்லாம் பேஷண்ட் வந்து நல்லா இருக்காங்க, நல்லா பேசிட்டு இருக்காங்க, மூளையில இரத்த கசிவு ஏற்பட்ட பேஷண்ட் நல்லா பேசிட்டு இருக்காங்க, திடீர்னு மோசமாகறாங்க, இல்ல நல்லா கண் முழிச்சு பார்த்துட்டு இருந்தாங்க, திடீர்னு சுயநினைவு போகுது அப்படின்னா அந்த மாதிரி பேஷண்ட்ஸுக்கு அறுவை சிகிச்சை கண்டிப்பாக தேவைப்படும். அது மாதிரி சில வேளைகளில் வந்து அந்த இரத்த கசிவு வந்து முதல்ல எடுத்த ஸ்கேனை விட ரெண்டாவது எடுத்த ஸ்கேன் வந்து இரத்த கசிவு அதிகமாக இருக்குது அப்படின்னா அப்பவும் வந்து அறுவை சிகிச்சை தேவைப்படலாம். இல்ல சில வேளைகள்ல வந்து அந்த இரத்த கசிவு வந்து ரொம்ப அதிகமா இருக்குது, அதாவது இந்த பேஷண்ட் இந்த இரத்த கசிவு வந்து மூளை அந்த இப்படியே விட்டோம் அப்படின்னா கண்டிப்பா அந்த பேஷண்ட் வந்து மோசமாயிடும் அப்படின்னு நமக்கு தோணுச்சு அப்படின்னா அப்ப வந்து அந்த இரத்த கசிவு வந்து முதல்ல அறுவை சிகிச்சை செய்து அகற்ற வேண்டும். ஸ்கேன்ல வந்து if we see there is a increased brainstem compression, அதாவது கொண்டை நரம்பு அழுத்தம் அதிகமா இருந்ததோ இல்ல மிட்லைன் ஷிஃப்ட் வந்து முதல்ல இருந்ததை விட ஸ்கேனை விட அதிகமாயிட்டே போகுது அப்படின்னா அந்த பேஷண்ட்டுக்கும் நம்ம வந்து அறுவை சிகிச்சை செய்ய வேண்டும். ஸோ என்னென்ன அறுவை சிகிச்சைலாம் இருக்கு அப்படின்னா, ஸோ அந்த டீகம்ப்ரசிவ் கிரேனியக்டமி, நம்ம ஜாஸ்பர் சார் சொன்ன மாதிரி இந்த குக்கர் ரிலீஸ் பண்ற மாதிரி, ஸோ அந்த எந்த பக்கம் இரத்த கசிவு இருக்கோ அந்த பக்கத்தில் உள்ள கபால எலும்பை எடுத்து அதுதான் கிரேனியக்டமின்னு சொல்றது, அது அந்த இரத்த கசிவையும் அகற்ற வேண்டும். அவ்வாறு அகற்றினா என்ன பிரயோஜனம்னா இந்த இரத்தக்கட்டுக்கு பக்கத்துல இருக்கிற நார்மல் பிரெயின் அழுத்தம் வந்து குறையும். அதோட அந்த மிட்லைன் ஷிஃப்ட், கொண்டை நரம்பு அழுத்தம், பிரெயின் ஸ்டெம் கம்ப்ரெஷன் எல்லாமே குறையும். அடுத்தது வந்து எண்டாஸ்கோபிக், இப்ப அட்வான்ஸ்டா வந்திருக்கு வந்து எண்டாஸ்கோபிக் மூலமாகவே அந்த இரத்தக்கட்டை வந்து அகற்றி விடலாம். இன்னும் மேலும் இப்போ ரீசெண்டா வந்திருக்கு வந்து கத்தீட்டர் ஆஸ்பிரேஷன். ஸோ கத்தீட்டர்ல மூலமாக அந்த இரத்த கசிவை வந்து கிளாட்டை வந்து லைஸ் பண்ற மருந்துகளை அப்ளை பண்ணி அந்த கிளாட்டை கரைத்து அந்த கத்தீட்டர் மூலமா அதை ஆஸ்பிரேட் பண்றது. ஸோ இது ஒரு வகையான அறுவை சிகிச்சை. ஸோ இதுதான் இந்த வெள்ளையா தெரிகிறது தான் இரத்த கசிவு. ஸோ இது இடது பக்கம் இருக்குது. ஸோ இடது பக்கம் உள்ள கபால எலும்பை எடுத்துட்டு நம்ம அந்த இரத்த கசிவையும் அகற்றுறோம். ஸோ அதனால ஏற்படுகின்ற அந்த மிட்லைன் ஷிஃப்ட், கொண்டை நரம்பு அழுத்தம், பிரெயின் ஸ்டெம் கம்ப்ரெஷன் எல்லாம் சரியாகுது. ஸோ இது வந்து சில பேஷண்ட்ஸ் இப்போ வந்து ரொம்ப மோசமா இருப்பாங்க, எடுத்த உடனே வந்து கை கால் அசைவே இல்லாம செயற்கை சுவாசத்துல கருவிலிகள்லாம் விரிந்து அந்த மாதிரி இருக்கிற பேஷண்ட்ஸ்க்குலாம் நம்ம வந்து அறுவை சிகிச்சை செய்தாலும் பிரயோஜனம் கிடையாது. ஸோ அதே மாதிரி கொண்ட நரம்புல பிரெயின் ஸ்டெம் ஹெமரேஜ், கொண்டை நரம்புலேயே ரத்த கசிவு இருக்குது அப்படின்னா இந்த பேஷண்ட் ஸ்கேன்ல பார்த்தீங்கன்னா தெரியும் கொண்ட நரம்புலேயே வந்து ரத்த கசிவு இருக்கு. ஸோ இந்த பேஷண்ட்டுக்கும் வந்து சர்ஜரி வந்து பெரிய அளவுக்கு பிரயோஜனமாக இருக்காது. நெக்ஸ்ட் வந்து நான் அனுரிசம்னா வேற ஒன்றும் இல்லை, ரத்த நாள கட்டி. ஸோ ரத்த நாளத்துல வந்து ரத்த நாளம் வந்து ஒரு பைப் மாதிரி இருக்கும், அதுல வந்து ஒரு பலூன் மாதிரி வீங்கி இருக்கிறது தான் அந்த ரத்த நாள கட்டி, அனுரிசம். ஸோ இந்த அனுரிசம் வந்து ஒரு ரேர் காஸ் ஆஃப் இன்ட்ராக்ரேனியல் ஹெமரேஜ். அதாவது பிபி ஹைப்பர் டென்ஷன் அளவுக்கு இல்லாம அப்பப்போ இந்த மாதிரி பேஷண்ட்ஸும் நாங்க பார்ப்போம். ஸோ இதுதான் அந்த ரத்த நாள கட்டி, அந்த வெள்ளையா பெருசா தெரிகிறது. ஸோ இதுக்கு வந்து எப்போ வந்து நம்ம இந்த மாதிரி ரத்த நாள கட்டி நம்ம தலையில வந்து அலார்மிங் சிக்னல்ஸ் அப்படின்னு சொல்லுவோம், அதாவது பிரச்சனை ஏற்படுத்தணும் அப்படின்னா, தாங்க முடியாத தலைவலி, வாந்தி, திடீர்னு வெட்டு வர்றது, இல்லது திடீரென்று சுயநினைவு இல்லாமல் போகிறது. ஸோ இந்த 3 இருந்ததுன்னா உடனே லேட் பண்ணவே கூடாது, உடனே ஹாஸ்பிட்டல் போய் ஸ்கேன் எடுத்து அதுக்குள்ள வைத்தியம் கண்டிப்பாக பார்க்க வேண்டும். ஸோ என்னென்ன வைத்தியம் இருக்கிறதுனா, அனுரிசம் அப்படின்னா கிளிப்பிங், காயிலிங், ஃப்ளோ டைவர்ட்டர். ஸோ கிளிப்பிங் வந்து அறுவை சிகிச்சை மூலமாக அந்த ரத்த நாள கட்டி போய் கிளிப் மூலமாக அந்த ரத்த நாள கட்டியோட பேஸ், அந்த நெக் ஆஃப் த அனுரிசம் சுட் பி கிளிப்டு. ஸோ இந்த போட்டோல பார்த்தீங்கன்னா தெரியும், இதான் அந்த அனுரிசம், அந்த ஆரோ போட்டு காமிச்சிருக்கிறது தான் நெக் ஆஃப் த அனுரிசம். ஸோ அதில் வந்து கிளிப்பை அப்ளை பண்ணுறது தான் சர்ஜரி. ஸோ இது வந்து ஓப்பன் சர்ஜரி, அறுவை சிகிச்சை மூலமாக தான் இந்த கிளிப் அப்ளை பண்ண முடியும். ஸோ இது வந்து காயிலிங். ஸோ காயிலிங் வந்து நம்ம இந்த ஹார்ட்டுக்கு ஸ்டண்டிங் பண்ற மாதிரி ரத்த நாளம் தொடையில இருந்தோ இல்ல கையில உள்ள ரத்த நாளம் மூலமாக கத்தீட்டர் மூலமாக நேரா போய் அந்த அனுரிசத்துல காயில்ஸை வந்து அப்ளை பண்றது தான் காயிலிங். ஸோ இது படங்கள்ல பாத்தீங்கன்னா தெரியும். அடுத்து வந்து ஃப்ளோ டைவர்ட்டர். ஸோ இந்த ஃப்ளோ டைவர்ட்டர் வந்து அந்த அனுரிசம், அந்த ரத்த நாள கட்டி, இந்த சோப்பா இருக்குது இல்ல, சோப்பு ஆரோ போட்டு காமிச்சிருக்காங்கல்ல, அந்த ரத்த நாள கட்டிக்கு போகின்ற ரத்த ஓட்டத்தை வந்து தடுத்துரும். ஸோ அதனால வந்து ஸோ அந்த டைவர்ட்டர் போட்ட பிறகு உள்ள படத்தை பார்த்தீங்கன்னா தெரியும், அந்த அனுரிசம் வந்து தெரியாது. ஸோ ஃப்ளோ டைவர்ட்டர், ஸோ இது வந்து சர்ஜரி கிடையாது, காயிலிங்கும் ஃப்ளோ டைவர்ட்டரும் சர்ஜரி கிடையாது. அது வந்து நம்ம இந்த ஹார்ட்டுக்கு ஸ்டண்ட் போடுற மாதிரி தொடையிலிருந்தோ இல்லை ரத்த நாளம் மூலமாக கத்தீட்டர் மூலமாக செய்யப்படுகின்ற சர்ஜரி. இதை நியூரோ சர்ஜன்ஸும் பண்றாங்க, ஈவன் இன்டர்வென்ஷனல் நியூராலஜிஸ்டும் பண்றாங்க. ஸோ நெக்ஸ்ட் ரத்த நாள கட்டி வந்து ஆர்டரியோவினஸ் மால்ஃபர்மேஷன். கெட்ட ரத்தமும் நல்ல ரத்தம் நாளங்களும் ஏற்படுகின்ற ஒரு மால்ஃபர்மேஷன். இது வந்து ஃபர்ஸ்ட் வந்து அந்த நல்ல ரத்த நாளம், அந்த கட்டிக்கு போற நல்ல ரத்த நாளத்தோட ரத்த ஓட்டத்தை அடைக்கணும், அதுதான் எம்பலைசேஷன். ஸோ எம்பலைசேஷன் ஃபர்ஸ்ட் பண்ணிட்டு அதுக்கப்புறம் சர்ஜரி பண்றது, ஓப்பன் சர்ஜரி, ஓப்பன் பண்ணி அறுவை சிகிச்சை மூலமாக அந்த ரத்த நாள கட்டியை அகற்றுவது வந்து ஈஸியா இருக்கும். ஸோ எம்பலைசேஷன் பண்ணிட்டு சர்ஜரி பண்றது ரொம்ப நல்லது. ஸோ இந்த படத்துல பாத்தீங்கன்னா தெரியும், இந்த நல்ல ரத்த நாளத்துல இருந்து இந்த ஒரு கருப்பா மொத்தமா தெரிகிறது தான் ரத்த நாள கட்டி. அதை எம்பலைஸ் பண்ண பிறகு அது சுத்தமா குறைஞ்சிருது. அதுக்கப்புறம் நம்ம அறுவை சிகிச்சை மூலமாக அதை எடுத்துக்கலாம். ஸோ அதுவுமே அறுவை சிகிச்சை எந்த இடத்துல எல்லாம் பண்ணணும் அப்படின்னா, இப்போ எலக்வன்ட் ரீஜன் இருக்கு. ஸோ இப்போ கை கால் சப்ளை பண்ற இடம் இல்ல முக்கியமான இடத்துல இருக்கிற ரத்த நாள கட்டியை வந்து அந்த அளவுக்கு அகற்றுறது வந்து நல்லது இல்லை. ஏன்னா அப்படி அகற்றணும் அப்படின்னா கை கால் வராம போறதுக்கு உள்ள வாய்ப்புகள் இருக்கு. ஸோ எலக்வன்ட் ரீஜன்ல உள்ளதை முடிந்த அளவு எம்பலைசேஷன்லேயே ட்ரீட் பண்ண பார்ப்போம், அறுவை சிகிச்சை சில வேளைகளில் தேவைப்படாது. ஸோ இது வந்து சும்மா ஒரு காமிக்கிறதுக்காக, இது ஒரு சிறுமூளை பக்கத்துல இருக்கிற ஒரு ரத்த நாள கட்டி, இது அறுவை சிகிச்சைக்கு பின் உள்ள இது. தேங்க்யூ.
Thank you so much, Dr. Sendil Babu, for breaking down all of the surgical options available. There are a few audience questions, so let's start taking those. Dr. Sivarajan, one of the questions is that one audience member wants to know that why is there an increased number of heart attacks or strokes in young adults who are working out or doing heavy weightlifting in the gym? Is that a risk factor?
Yes, it's a worrying risk factor, mainly because it is quite often seen in individuals who suddenly take up these activities and they go on to increase their workload at a very faster pace. You need to build it up rather than suddenly go out and do all these things. And you need to be associated with a proper gym trainer or a physical therapist who could advise you on how to gradually increase your activity. There are certain individuals who may have pre-existing heart conditions which they may not be aware of. So there was a recent incidence of similar thing happening in a famous actor in, I think, in the Kannada industry, and we do see that in. I mean, we have heard that stories. A lot of CEOs and in the social media suddenly they drop dead while they were in the gym and so on. That's purely because either they are doing it in a very excessive and a very unhealthy way, and they're probably under a lot of stress and having lack of sleep, which can increase their cortisol levels. And when they go on to exercise, that can put a very high load of stress on the heart, which can make the heart go very abnormal in rhythm, or have sudden changes in the vessels causing heart attacks. And same thing may be true with sudden brain hemorrhage when they do sudden uh, lifting. Dead weight has become a fashion nowadays. People say done 50 kilos, 100 kilos, and that's something it's very dangerous unless you do it in a proper way. It can hurt your back. You can end up with lumbar disc and cervical disc problems, not only strokes. Dr. Jose, you want to add anything to this?
I think your answer was very elaborate. Yeah.
Dr. Jose, one quick question. You spoke about COVID and post-COVID, what has been happening in terms of sedentary lifestyle. I also want to ask whether there's a link between the COVID infection itself and stroke.
I think initially there was lots of, lack of awareness of COVID itself and COVID vaccine itself. So we did run into certain problems because they did cause both thrombotic stage. But I think now we are not really seeing a lot of numbers because of COVID itself. What we are seeing is that 2, 3 months we all stayed at home. We got used to a lifestyle where we are all lazy and we are still paying the price. We don't want to be as active as before. That is what.
Right. Moving on, some more audience questions are there. Dr. Sendal Babu, one audience question is, what are the minimally invasive procedures for ischemic stroke?
What are the?
Sorry, what are the minimally invasive procedures?
For ischemic strokes.
Ischemic stroke.
Yes.
So I think Dr. Jose Jasper has already elaborated about thrombectomy. That's probably what the audience want to know. So in thrombectomies, we have two methods. One is a stent retriever, and another one is a aspiration technique. And sometimes we combine both and call it as Solumbra. And this is transformed. This has transformed the acute stroke care, because a lot of individuals who are not eligible for thrombolysis, or if they're out of window period, they may not get the right treatment. So the thrombectomy has revolutionized the care across the world. And as the technology in the device has evolved rapidly, we are seeing highly refined devices which can even be used beyond the 8 hour, 12-hour window period. And with the use of the right multimodal imaging, we can choose patients who may otherwise be denied treatment. There are patients who may have a lot of deficit, like meaning inability to move arm and leg, or inability to talk, but the brain is still a little viable. They may still have collaterals that is trying to perfuse those areas. In those individuals, we can go and take the clot out. They may recover quite rapidly. And with new technology, we can choose these individuals nowadays. But as we always say, you should be at the right place at the right time. That's why we always talk about stroke ready hospitals. So unless you are in a place where they have the right technology, you won't be able to get this sort of treatment.
Thank you, Doctor. Dr. Jose, one question on is there a genetic risk if you have a family history of stroke? Is that also an issue?
Yes, stroke. Indians usually we have a higher incidence of stroke. Indians per se. The World Stroke Organization says 1 in 5 or 1 in 6 of us will get a stroke. That is because we have a higher incidence of diabetes, hypertension, etc. And there are certain specific diseases where stroke does occur among families. So yes, genetic, not very common, but more common is the bad genes, and that leads to a bad lifestyle, that leads to bad, cholesterol, etc., and all that. Yes.
One more question is that after the age of 50, is it a good idea to get a carotid Doppler test done?
I'll ask Dr. Sivarajan to answer that.
Yes, sure.
Yes. I mean, this has frequently come up in our discussions, and when you go for a master health check, often we talk about intimal thickening scan and the calcium scoring scan for the coronaries and so on. The same way, we should encourage carotid Doppler screening in about 50 or at least 60. 50 is a little early for carotids. I mean, when you look at the natural incidence of peripheral vascular disease and coronary and carotids, usually the first part of the vessels that get affected is the peripheral, and then coronaries, and then the carotids. If somebody has been a heavy smoker in the past, then the incidence of carotid stenosis is quite high. So especially if somebody is a smoker and have increased alcohol intake, every time they go for a master health check, it's better to insist on having a carotid Doppler, a proper Doppler, not an intimal thickening scan, proper Doppler to be taken. Because quite often every test comes as normal, but 2 3 years down the line they may end up with a large stroke because the carotid stenosis was missed in those individuals.
And I'll just like to add a point, if you don't mind, Dr. Sivarajan. Any patient with a cardiac stroke can end up with a brain stroke, usually because all these are interconnected. So I feel any patient or a family which has a history of cardiac disease, I think they must be more aggressive in looking for even carotid disease.
Thank you, doctors. One more audience question is about can the clot in the varicose vein, is that a risk factor for stroke?
No, varicose veins are superficial veins, um, and there is a risk of stroke in those who are prone for deep vein thrombosis. These individuals may have a genetic tendency for easy clotting, something called thrombophilia. It may be due to genetic risk factors like factor V Leiden. There are certain clotting factor abnormalities which can be hereditary. It can be a sort of certain genetic aberration in certain individuals without being hereditary. In these individuals, they can have a high instead of DVT, meaning deep vein thrombosis. And if you look at the general population as a whole, nearly 20% of us have a small hole in the heart between left and right chambers called PFO, patent foramen ovale. And these are the so individuals who may be prone for strokes. The DVT, the deep vein thrombus, normally will go and get filtered in the lungs. But in these individuals with PFO, it can cross over to the arterial side on the left side of the heart, and that can jump into any part of the brain and cause a stroke. So it's not varicose veins. Varicose veins is very common. It's very innocent. We don't need to worry about individuals with varicose veins. Those who have a high incidence of DVT, or if there's a family history of DVT, or if somebody has a history of autoimmune disorder like SLE and so on, they are the ones who should be worried about clots.
Thank you, doctor. Another question is that, so once you have a stroke, what is the possible length of time after which your motor strength and your regular strength comes back to normal? What is the general prognosis of this?
Okay, I'll answer. Yeah.
Okay. So,
okay, sorry.
yes, please. You start பண்ணுங்க, then
Yes,
I can.
yes,
Yeah.
Dr. Joseph.
I'll just say in 2 lines. Yeah. If the stroke happens in a very important part of the brain, a very eloquent part, a dense stroke, then usually the patient never recovers at all. So actually, your clinical and motor recovery depends on where the stroke happens, the density of the stroke, the amount of brain matter that is involved, and the amount of flow of blood that comes into the brain from other parts, otherwise what we call as collaterals. So there is no one criteria to say this patient will come back in so many weeks. Sir, Swarajan, you want to add?
Anyone want to add to
The,
that?
the recovery process is quite a long process, and quite often we see the maximal recovery in the first 3 months. And there are individuals who can continue to recover even up to a year and beyond. But they have to be under the guidance of the right team of therapists, physiotherapists, occupational therapists, speech therapists, and a lot of new technology that is also helping with recovery. In the recent World Stroke Congress, we had a lot of clinical trials being published on transcranial magnetic stimulation, direct current stimulation, and also a lot of technology that's being used, like the visual feedback technologies and so on. And there are a lot of electrical stimulation FES, or functional electrical stimulation devices that can be used in individuals who may not otherwise recover with just hands-on physical therapy. So the technology is going to help in a big way in doing more repetitions. So therapy is purely on the amount of repetition of activities you do to certain joints and muscles and so on, and it should be tailored according to the individual needs. So uh, physiotherapy is, again, it's not a broad specialty. There are neurophysiotherapists or stroke physiotherapists. We have speech therapists and so on. So it has to be individualized and tailor-made. So if they are in the right guidance, their recovery can carry on even beyond 6 months to 1 year.
I think we have time just for two more questions because we have already run over our limit. One is doctors who would like to take this about calcification in the brain. What causes this, and is that a risk?
I think that's a very non-specific question. We are more worried, like we can have some deposition of calcium-like material in the brain that can be even a variant, a normal variant. But what we are more worried about is deposition of calcium in the blood vessel. And that is what hurts the brain in the long run.
Right. Last question. If all of you could address it one by one, just do's and don'ts for young patients to avoid strokes.
Rajan, sir.
Okay, so yes, I mean, we are more concerned about youngsters having strokes, and they're easily preventable. And the higher number of jobs that youngsters are into are mostly sitting jobs, sedentary jobs. So we do say sitting is the new smoking. The more number of hours we are simply sitting, it's almost like having several packets of cigarettes a day, which increases the risk of diabetes, hypertension, heart attacks, and strokes. So I always tell my patients to get out of their chair every 20 minutes, once every 20 minutes, and do a brisk walking, even while they're doing calls or anything. Go up and down stairs, couple of floors, and then come back to the chair. So youngsters, uh, be more active and less sedentary. That's my main sort of.
That's one great point. Be less sedentary. Dr. Juice, anything to add? Do or don't?
I'd like to say it in simple words. Know your numbers. When you're young, you think you're beyond all this. When you're young, you think you're immortal. But a human body is not built like that. You have to know your numbers. You have to know your BP. You have to know your sugars, your cholesterol, etc. So a regular health checkup once in a while. And if you have family history of stroke, if there is high risk lifestyle, high risk of stroke, yes, you have to be more stroke specifically aware.
Here, Dr. Senthil Babu, any do or don't that you want to add to this list?
Recently, we see more cases of substance addiction, and more young people with stroke. They are addicted to substance, and we lose them because directly they come with GCS3, actually the deep coma stage. So nothing could be done for them, and when they have a stress, even after trauma, they develop stroke, especially these substance addiction patients.
Thank you. So be more active in your lifestyle, know your numbers, don't get addicted to substance. Thank you very much, Dr. That was a great session. Thank you.
Thank you. Thank you, doctor. Thank you, Subeda.
Thank you, Martha.
Thank you.
Mm.